Hello, I'm Dr. John Abebe, the Medical Director of Georgia Abebe Fertility Center. Once again, welcome to this video series. So today in this video, we'll be talking about the treatment plan, the counseling, and then the signing of consent for patients who are going through the IVF program. Now, what that therefore means is that for patients who have gotten to this point, you've already gone through the registration and consultation, you've had your fertility investigations done, you've had your results reviewed, and the treatment options have been decided already. And thereafter, you would now go ahead to make your payment. All right. Once your payment has been completed, you will have a treatment plan that will be sent to you. Now, you can make your payments in installments, but it has to be completed for you to move to this next stage, which is to have your treatment plan drawn up and sent to you. All patients who are going through IVF treatment at the Georgia Abebe Fertility Center must have a treatment plan sent to them. It's a summary of your program that gives you dates, although some of those dates may be tentative, but it summarizes and it guides you on how your program is going to go. So that plan will be done and it will be sent to you. For patients who are based in Abuja, a lot of times you're required to come in physically to sit with the nurse so that they can explain the program to you, and thereafter you go on to sign the consent form. However, for a lot of our patients who are not based in Abuja, the program will be sent to you via WhatsApp, and then it usually will be accompanied by a voice message. Please, you go through that voice message, and then there will be a phone call conversation just to ensure you understand the program. It's important to note that some of those dates that are on that program are very tentative. For example, the treatment program will have things like when you commence your menstrual regulation, that is when you're starting your level FEM or premenstrual end, when it will end, and when you have to start your down regulation, particularly for patients who are recipient patients who require egg donors. All right, it will state when you are to have your Zoladex or Lupodex injection. That's pretty fixed. Once you have that date usually does not change. But the dates that will change will probably be dates where you are to have your withdrawal bleeding, which can vary from 3 to 5 days, sometimes 7 days. Some patients may not even see it until more than after 7 to 10 days. All right, and when you have your withdrawal bleeding will not determine when your program proper will not start. All right. And so you will have those dates that will be there when you are supposed to come in for your scans. If it's a self program, when you have to come in, your injections will be daily, and then it will tell you when you have to come in for your scans. If it's a recipient program, it will also tell you when you have to come in for your scans. And then the two important dates that are very tentative and usually most likely will change are the days for either oocyte retrieval or insemination, and then the transfer date. Of course, if you have your oocyte retrieval or insemination, 5 days after is when the embryo transfer would take place. So the dates that you have on that program are just to guide you, to give you a guide so that you know how your program is going to go on. Now, after you have been counseled and explained to what the program is all about, you won't be required to sign the consent forms. All patients going through our programs are required to sign the relevant consent form authorizing us to go ahead with the program. All right, and thereafter you would start your menstrual regulation. Typically we use the level FEM or premenstrual end depending on the patient and what protocol we are using. All right. So the patient follows the treatment plan. You know when you're starting your menstrual regulation, when you're ending, when you're taking your Zoladex for down regulation, and when you expect to have your withdrawal bleed. And typically what will happen is that you will be counseled that once you have your withdrawal bleed, you have to call the front desk to book your appointment for the next stage of your program. And that is what we'll be talking about in the next video. Have a wonderful day. God bless you.